everyone. Thank you for being here. Christine Hill with Public Relations here at Hennepin Healthcare. I have Dr. Tom Wyatt. He is the chair of emergency medicine here at Hennepin County Medical Center. Dr. Wyatt, he's going to give you an update.
Hi, everybody. My name is Tom Wyatt. I'm an emergency physician. I'm chair of emergency medicine here at Hennepin Healthcare. I'm here to provide you with a brief update of the care that was delivered here at Hennepin Healthcare related to this tragic event that occurred this morning. We first received a page that we were going to have a mass casualty incident at 8:46 a.m. this morning. That gave us time to mobilize all of our resources and prepare our teams. We are a level 1 trauma center, and we prepare and we train for this. Having said that these incidents are never easy. We've had 2 in the last 24 hours that have occurred, these mass casualty incidents. The one today, we received a total of 11 patients from this incident. 2 of them were adult patients, 9 pediatric patients. 4 of them required the operating room, and up to this point in time, there have been no fatalities related to any of those patients that were brought to our organization. I want to take a moment to tell you how proud I am to work for this organization and the teams that were involved, the resources, again, that were mobilized, our surgical colleagues, our medical medicine colleagues, our amazing nursing staff, our psychologists that help process these events for us, environmental services, all those involved. Hennepin EMS brought in all the critical scene to our organization, and we're very lucky to have 2 emergency medicine, emergency medical services directors that were on scene and able to provide us with really important information that again helped us to prepare for this event. So I don't have any individual or specific information about the patients at this time for you, so that's all I can share. Thank you for being here. Any questions?
You said they were in critical condition?
7 were brought in as critical patients, and at this time I don't know the updates on what the conditions are of many of them. 4 of them required the operating room, as I said.
There was babies?
There were, again, 9 of the 11 patients were pediatric ages. I can't remember the exact name, the exact ages. I believe it's 6 all the way up to 14. That's the range.
Can you tell us a little bit about what types of teams you had working this morning, how many people it takes to treat a scene like that?
Yeah, you know, whenever that type of a page goes out, again, it really puts into motion a lot of a big response from all of the teams. And so we are, because we're a level 1 trauma center, we have to, mobilize certain types of resources like, operating rooms and the surgical services. We have to have emergency providers and nurses. We have to, mobilize things like the laboratory and the blood bank. So there's a lot of planning, and again, a lot of exercises we do throughout the year to prepare for these events. And unfortunately, we respond to many of them throughout the year.
Can you talk about the injuries at all, or any type of what you're seeing here with some of these patients?
I can't get into specifics, but we are dealing with gunshot wound injuries from apparently a high-velocity weapon. And, gunshot wounds can be very problematic because they can involve multiple body systems. And again, they require a lot of resources to manage. But again, we see a lot of gunshot wounds here at Hennepin Healthcare, and we're among the best in the nation every year at managing penetrating trauma. So we are used to seeing them.
Can you tell us where the status of the 11, are any of them still in surgery?
I don't know the status of that. I can't share that with you at this time.
Has anyone shot more than once?
I can't share that information with you at this time.
Can you confirm the families of some of the victims that made their way here?
Yeah, we've had quite a bit of effort to stand up a reunification center across the street here at our clinical specialty care building. And so to my knowledge, I believe all or almost all of the families and loved ones have been reunited with patients and know their status.
Do you know if anyone is being treated at any other locations?
My understanding was we had a lot of the non-critical patients that went to Children's Hospital, and I believe one went to Masonic Children's Hospital as well. I don't know the status of any of those patients.
Can you speak to the toll it takes
it does take a toll. Thank you for asking that question. I think again, we have psychologists that we have dedicated to our emergency department to help with our providers and our nurses and other workers that manage these types of events. Again, we've had 2 mass casualty events happen in the last 24 hours. I mean, that does take a toll. But we also have to recognize that we are here as a critical resource for our community, and we have to take time to process, the care that we deliver in these situations, and we have to be able to move forward because we are obviously needed.
And none of those patients have been discharged?
Not to my knowledge.
You said there were 11 total, and 9 of them were pediatrics ages 6 to 14, but 7 were in critical condition. Are all of those that are pediatric, those 6 to 14, are all of those in critical condition, or the ones that are older also in critical condition?
I don't want to misspeak here. I believe that all of the pediatric patients were the ones that were in a critical condition. Yes.
Did I get my numbers right in saying that?
You did.
Can you give us your specific title one more time, Doctor?
It's Thomas Wyatt. Yeah, Chair of Emergency Medicine at Hennepin Healthcare.
Thank you.
Thank you.